And now we're recording and say welcome to today's seminar. And Dr. Khalid Abdalhai, our senior registrar from the Sudan, who is currently in South Africa and unable to visit his family. You were going to be visiting them sometime soon, weren't you, Khalid? Has kindly offered to do this seminar for us today. So Khalid, you're very welcome to share your screen now and to take over.
Okay, thank you, Prof, for the present, for the introduction. So my topic today is will be about the stress and COVID pandemics, a view of the current situation and the implications in country. And this topic is important because I will address the psychological and psychiatric basis of pandemic diseases in general. And most of the time, people, they talk about the physical components of pandemics, like the transmission, vaccination, prevention, and preventive measures and interventions, and etc. But and ignoring the other psychological aspects of outbreaks. So, and adding to that, the uncertainty and misinformation that's hanging around during the time of pandemics, it gives like more effect on our psychological life. So basically, the outlines of my presentation will be like the following. I will talk first about what is the definition of pandemic and pandemic related stress and the possible psychosocial consequences and the future expectations. So in the first, that I will just give like a definition of the difference between pandemic and epidemic and some short history about them. And then I will move to talk about the stress and how to define stress and how stress affects our body. And then talking about the possible psychosocial consequences or health-related issues, I can say. And then the expectations for the let us say near future. So I made my presentation in form of questions or queries, and I have answered to some of them, and some of them I don't have an answer, and I will leave it for more discussion. So the first component or the first question is what's pandemic, epidemic, and outbreak. So why I propose this question, because generally when I ask some of my colleagues, well, the difference between those pandemic and epidemic and outbreak, is it the same thing or is it something like different? So simply the WHO defined the word epidemic when the disease affects a large number of people within a community or population or region. So, and the pandemic is an epidemic that's spread over multiple countries. So an epidemic, so we can say epidemic can occur here in South Africa. It can occur in a place, let's say a certain place or certain region. But when the pandemics distributed or involve many countries, then we call this an epidemic. So as you see here in this slide, we can say there is an epidemic in this area of Africa, for example. But when it's cross the region and involve many countries, and then we call it like pandemic. So that means this the effect of the COVID-19 is a pandemic that involves many countries. So it's not just affecting our region or our place, it affects many places. So, and to have pandemics occurs through the history of humanity. It's not just a recent thing. But I will just talk about the pandemics or the history of pandemics during the last 100 years. So there are lots of pandemics that happen in the last 100 years from the last century till now. One of the most popular one is the Spanish flu that happened in 1918. And also it was like an influenza. So the death related to influenza, it was like 40 to 50 million. So and then we moved down till we reached the COVID-19, which is start in 2019, and it's a coronavirus. It is a virus, and the host of the virus is still it's not well known, but there's most of the infectious disease specialists, they talk about pangolins. Do you know pangolins? I personally, I don't know the pangolins, but I search about the pangolins. So pangolins is like an animal that so it's used, actually it's the scale of the animal or the skin of the animal is used in the traditional medicines in some areas in Asia, and it's a very very good business for them. And then eventually, of course, they eat the pangolin. So back to the one of the famous pandemics. So why I choose this Spanish flu, because it's it has like characteristic history, and the complications related to the Spanish flu was a little bit very interesting to mention. So that the Spanish flu, as I said, it started in 1918, and it has like two peaks. The first peak, when it started, it affects a certain group of people or certain number of people, and then the people they thought it's gone and it's fine now. People, they can go out and they can do their usual life, and again it hits them again. So it has like two peaks. The first peak, the number of deaths was few, maybe less than 5 million. But the second peak, it's related to high number of deaths. And the explanation of these two peaks is the virus itself. Sometimes it changes its ways of infection, or it mutates. So either the virus has two fates, either to shift to another form, and we call it the virus shift, or the viral shift, or the virus is start to lose it or to attenuate or to become less infectious, and then we call it the viral drift, either the shift or drift. So what's happened with the Spanish flu, the virus get shift instead of drift. But most of the other pandemics are related to drift, not shift. Okay, so and this will take me to the second point of uncertainty related to pandemics. So the uncertainty, the pandemics are frequently marked by uncertainty, confusion, and a sense of urgency. This is what WHO said. So the uncertainty is related to many things. Just if I randomly ask you these questions, you will have like variable answers, like level of danger. Is it dangerous or not? Route of transmission. Is it like droplet transmission or airborne? I mean, I'm talking about COVID-19. Or airborne infection, the way of testing, can we use only the PCR set of investigations, or we can rely on the CBC and just scanning and so forth, and how long it will last. We don't know how long it will last. Yesterday I heard in the news the WHO, the executive, I think executive manager of the emergency program in the WHO, he said, we don't know how long it was going to last, and even we don't have any expectation, and no vaccine has been has been tested or proved effective with this COVID. And again, the prevention and the social distancing, and even in the management, if the patient got infected with COVID-19. So even there is no clear management protocol. So every hospital or every health institution, they follow their, I can say, their own clinical sense based on the available evidence that they have. Okay, so that means it can lead to stress, and is the issue of stress and psychological related distress to pandemics is not well addressed in the psychiatric textbooks or psychiatric literature, in its name, I mean. But there are two main subspecialties in psychiatry in general. I can say they address, indirectly, they address the pandemics, like the consultation liaison psychiatry, which is a subspecialty in psychiatry that deals with the interface between the mental and medical specialties. And the other specialty is, or area of specialty in psychiatry, is disaster psychiatry, where they talk about the psychiatric and psychological health-related issues to disaster, the natural disasters and man-made disasters. Okay, so it's as I said, it leads to stress, yes. And what is stress? Stress is defined as a pressure experienced by a person in response to life demands. So basically, the definition of stress, it comes from physics. So let me just give a short example about the stress. So let's assume this pen. If I press on this pen, it can break at any time. So breaking of this pen, it depends on my pressure, or my how powerful my stress, my pressure on this pen, and then it depends, and also it depends on the resistance of the pen, how this pen is strong. So from this definition, we have like I can say stressor, the circumstances, the pressure itself is stressor that disrupt or threatening to disrupt person's physical, psychological functioning, and the stress response, the process till the pen is being broke by this pressure. The process, we call it the stress response, is adjusting to or dealing with circumstances that disrupt or threatening to disrupt person's physical or psychological functioning. And this stress can be internal or external, or can be both. So internal, when someone has excessive thinking, fear, guilt, and so forth, this is internal. Or it can be a real traumatic experience, or something from outside or from the external world, and we call it these are we call it external, or it can be both of them. So, and we have many types of stressors, which can be normal stressors, or we call it normative stressor versus catastrophic stressors. The normative stressors is like when a lady give birth to a child, or when someone get married. So this is a normal stress. And and catastrophic stress may be the death of loved one, yeah. So I can put the COVID pandemic as it's not an, I can say it's not it's an external stressor, and it's very overwhelming, and also it can be internal when someone start to react to them. So as again, many types of stressors in our life. I can say financial, academic, marital, family issues, religious conflicts, and so forth. But what is common between all this, the psychological, or I can say the psychological component. Okay, so as I said, stress is it's varied. It at some point stress is good for our performance. So when the level of stress is low, or I can say moderate, this will lead to high performance. But when the level of stress is exceeding, it will lead to breakdown and dysfunction. Okay, so when someone it can lead eventually to dysfunction. So, and when dysfunction happen related to stress, it can be in form of either feelings or behavior or thoughts or sensations or physical sensation. So, like thoughts, for example, like worries, problem with concentration, problem with yeah, fears, and so on. And in the emotions, like the nervousness, uncomfortable, and feeling of uneasiness. And in behavior, it can be a list of, as you see in front of you in the screen, try to increase the certainty and excessive checking, and to adopt a behavior that help them to prevent this or to deal with this stress. And it can also be physical. When someone starts to experience high level of stress or distress in their life, they will start to show some physical symptoms. Okay, so it's again the same. It's just a repetition. So moving from now we talk about the what's the pandemics and what's the stress and defining it. So as I said, when the level of stress exceeding our ability to cope with that stress, it will lead to dysfunction. But in the journey between the stress to dysfunction, there are many changes in our body, and mainly these changes are related to physical changes and some psychological changes. So it's not only that, so it can lead to also physical changes. There are three major components in our body that we respond to when we respond to stress and level of stress. So the first one is the nervous system, you know, the nervous system, and the endocrine system, and the immune system. So I will just quickly show this video and then move to the rest of the presentation. I don't know if can you hear?
Stress response.
Can you hear?
In stressful situations, the body switches on its autonomic nervous system and neurobiological processes in an attempt to maintain homeostasis. The body is prepared for its reaction to stress. In the brain, the hypothalamus is connected to the pituitary gland. The hypothalamus, stimulated by the sympathetic nervous system, releases the hormone corticotrophin releasing factor, CRF. The CRF activates the pituitary gland to release the adrenocorticotrophic hormone, ACTH. This in turn alerts the adrenal glands. The adrenal glands are located on top of each kidney. The ACTH from the pituitary gland stimulates the adrenal cortex to release cortisol. At the same time, neurons in the hypothalamus signal the medulla to release epinephrine, adrenaline, and norepinephrine, noradrenaline. These hormones then push the body into hyperalertness.
Okay, so it's not complicated video, but I will just try to explain it more. So when someone experiences level of stress, some parts in our brain is going to be active. So this part we call it the hypothalamus in our brain. Then it will give like signals to a gland in our brain called pituitary gland. Then it will send signals to a gland also in the suprarenal. We call it suprarenal gland. So this suprarenal gland produces main three neurotransmitters or hormones. I mean neurotransmitters. So the adrenaline and noradrenaline and the cortisol, and this play very important role in like the other symptoms, the physical symptoms, I mean like the palpitations and heart rate, and someone is ready to fight and flight, we call it. I will show you in the next slide. So the nervous system, we have two types of the nervous system. Mostly during the time of stress, the most active one is the sympathetic nervous system. So the sympathetic nervous system is related to fight and flight response. And then the endocrine system, with increase in the level of the cortisol and some fatty acids and insulin and blood sugar. And then the immune system, which is related to some immune modulators and inflammatory mediators. And the immune system usually associated with chronic activation or long-term stress or chronic levels of stress. Okay, so the function of all these body responses are to protect ourselves from expected danger. So, but when the response exceeds the situation, then it will lead to dysfunction, and this we call it allostasis. And the interaction of this system maintain the homeostasis and well-being, as I said, but when it exceeds and become more, it will lead to even physical illnesses or physical diseases like hypertension, obesity, and even changes in the brain, in neurons in the brain, especially in the hippocampus and prefrontal cortex, and increase in the level of activity in the amygdala. Okay, so that means the conclusion of these two slides, that means it affects also our bodies. And then I'm talking about, so our response to stress is different from person to person. So we can all experience the same stress, but our level of reaction to this stress is different. So this is the thesis stress model, where the thesis is like predisposition and stress that we experience in our life that can lead to a disorder or a dysfunction, let us say, with a not disorder. So vulnerable, for example, vulnerable individuals, if they do not experience anything in their life, it's fine. When they experience any difficulties in their life, they have a negative outcome of this. So the idea of the thesis model is it's like a combination of predisposing and stress exceeding the threshold, and then the person develop the disorder. So in one of the famous studies of the advanced childhood experiences, so I'm sorry because I sometimes jump from talking about general concept and going back to children. So the adverse childhood experience study is one of the largest investigations conducted to assess the relation between the childhood trauma and life threat and later life health and well-being. So it's apparently from the study is differences in or adverse childhood experiences. I can include the COVID, I can include abuse, I can include all the other related health adverse experiences. It can lead eventually to diseases, disabilities, and social problem, and even put them at risk to develop certain psychiatric disorders like anxiety and depression and early death. So now back to our main topic of what was our main topic? It was about the stress and COVID-19. So after we had this basic concept and let us talk about the effect of this on our children and adolescents. I mean the psychological and social effect of this. So to answer this question, I will talk about the general consequences or the possible consequences that can happen in children and adolescents. So I got this information from a textbook of psychiatry and pandemics. So they put them like this. It's a time lapse. The mental health response in pandemic outbreaks are the time lapse. And the time lapse, it means there is a short time to react on. A short time from the onset till the end of the disease. There is like a short time, but this is very valuable time to plan and to prepare and to intervene and so on. And there is a big burden on health workers, especially those who work in the front line. They in previous pandemics like the SARS in 2003. In SARS, they say the rate of PTSD among health worker personnel in such situation is around 20%. 20% is not like only just by screening, but it's diagnosed, clinically assessed and diagnosed. It's 20%. That 20% is very high. And then the quarantine, a routinely practiced method in the infectious disease together with social distances, also this add to our mental health. And the neuropsychiatric sequelae. And the neuropsychiatric sequelae is very interesting area for researchers and for like to make an observation on that area, especially the cognitive changes that happen after, if there is a CNS involvement, delirium, cognitive impairment, and so forth. So it's very interesting also for us as a mental health specialists to pay attention to this area. And behavioral contagion, so the fear and misconception they circulate between group of health professionals in general. So and this they call it it's like behavioral contagion theory or something like this. So is the collective behavior that explains how the crowd can cause impact on the individual's behavior or the emotion. And this reminds me a book of I don't know of who, but it's about the let me remember, study of crowd or something like this. So if someone remember, just remind me after the end of the my talk. So, and moreover, I can make it more systematically. So the psychological, the social, and other. So in the psychological consequences of this COVID-19 is we can see new symptoms, onset of new symptoms like anxiety, depression, neuropsychiatric complication, as I said, substance-related disorder, and so on. Or we can see the exacerbation of pre-existing psychiatric disorders, And then moving into social, there are a lot of social consequences that we can consider: the loss of social support and network, and distancing, and the violence that can be related to that people stay in confined place, and there is high risk, or increasing risk of violence, and some cultural beliefs, especially, and religious beliefs, and events that maybe wrong news that we hear on TV and social media, and economic and political structures. Some people, they try to fight in political terms, using the COVID-19 for their benefits. I know many examples, even in my country now they are doing like this, and they are conspiracy theory. So, so when I was reading about the conspiracy, so my main source for this presentation is a book, Psychiatry and Pandemics, I think. So it's published in 2019 in August. I asked myself why they published this book in 2 or 3 months before the pandemic, and you hear the speech between presidents of some countries that accusing each other, you distribute this virus to the world, and so on. Okay, so the first step of when we want to target any pandemic, or from psychological or psychiatric point of view, to seek or to prevent this mental problem among disadvantaged or among people at risk, we need to answer this question, or to see who are at risk. In generally, when we expose to traumatic events, I can say traumatic events, around 60 to 80% of the population experience trauma-related symptoms. 60 to 80 experience trauma-related, but only a small number of them will end up with the real trauma-related disorder, and the majority of them, they will just respond to family support and help from friends and community and so on. So this you have like better idea of it. I grabbed this data from a study published in the Journal of European Pediatric Association. So this study is investigating the common symptoms or psychological symptoms that children present with. It was in China in February. It investigated 320 child from 3 months to 17 years. Most of them, either they are infected or in contact with infected persons. So obviously it was like due to the restriction of the social gathering and social contacts, it was an online filled by the parents. And the questionnaire used the DSM-5 criteria of an anxiety, depression, and trauma-related disorder. So the study concluded the children and adolescents, they can present asymptomatic, or they can present with upper respiratory tract infection, not like in adults. Most of them, they present with severe complication and lower respiratory tract infection, and even milder symptoms and GI symptoms. So it's most of the symptoms are not specific to respiratory system. And children and adolescents have more psychological impact than in adults. And the symptoms revealed from the study is like clinginess, distraction, irritability, and fear of asking questions about the pandemic. And children aged 3 to 6 years, mainly they show clinginess and fear that family member could contract the infection. And children aged 6 to 18 years were more likely to show inattention and persistence in inquiry. So these are I took this figure from the study, mainly the clinginess followed by inattention. They put them in hierarchy. Yeah. So back to our question, who are at risk. So the survivors of COVID infection, those are at risk, and presence of multiple physical illnesses and using of medications, especially the respiratory illnesses and CNS pathologies. And low economic resources, multiple symptoms of stress, and multiple stress in our life. All of these are, like individuals who carry this kind of risk. They are at risk to develop the symptoms related to stress. And the past psychiatric history of behavioral disorder, attachment-related problems, and anxiety, OCD. I'm not sure about the OCD. I put it by myself just for discussion if you have something to add. Okay, so what are the expectations for the near future? What are our expectations for the near future? No one exactly knows what's going to happen, but the possibilities are in our work as a mental health professional in DCAP. My feeling that we are going to see more cases, mainly in the CL referral, and all patients with disorders that affect the cognitive functions are mostly at risk. So because especially those with cognitive function, they have sometimes limited ability to understand or to comply with critically important instructions. And so I just remember now while I'm talking, some children, they don't talk about their fearfulness from COVID, but they can present in a different way. Now I remember one of my patients that I saw before 2 weeks, a child with become very afraid from being separated from his parent. He's 7 years old. So, and this happened just recently, like in the last month. So, and of course, if most of you, if you start to remember during the last months, and if you see patients during the last months, you will remember some of these symptoms. Okay, so what to do is like this simple check and screening for your patient, just checking, asking questions, especially about COVID, how do you feel? And yeah, and you know, just it's like an open discussion with your child, and then go deeper to ask about symptoms of anxiety and fear related to stress. And using you can use also validated questionnaires. I tried to find some, but I honestly failed to find anyone. There is questionnaires that use to or scales that use to screen for PTSD specifically, but not for stress in specific. If we can discuss on this later. So, can we minimize the risk? Yes, there has been like many programs that for children and for parents that introduced by many scholars. So many programs in different languages, and they use videos, they use messages and so on, just to provide support to children and adolescents and to their parents. These are just examples from what I have from only from one or two groups that in the WhatsApp I have. Okay, so but the core principles of these support or interventions are the structured time and activity and routine. So we need to ensure that children during the time of this pandemic, and probably the social the rules of the social distancing and so on, they have structured activity and routine at home, and this routine and activity designed to resemble the pre-isolation or the pre-pandemic, let's say pre-pandemic times, and also to provide the virtual classroom should be considered. And some of these core principles also are applicable for children admitted to the hospital, not only for other children outside the hospital. And the use of internet should be allowed and tolerated, but the use of social media should be monitored, especially because of dissemination of inaccurate and inappropriate messages sometimes, and provide information to children in age-appropriate fashion to them. I don't think I have more slides, but generally, I will leave this for discussion. What are the lessons and wisdom that we are doing in DCAP here, that in line with those being said, or in line with your with the international atmosphere. Thank you.
Great, thank you. We'll give you a round of applause first. And if you can stop sharing your screen, then I can put everyone else up again. There we go, great. So thank you, Khalid. And I think, what I liked that you showed us the kind of biological stress responses, and that you talked about stressors as internal and external. And it just reminds us to remind ourselves and our families that an external stressor we may not be able to manage or control, or we can try and stay away from people and do all the social distancing stuff. But the internal stresses are things that are under our control. These are things that we can work with psychologically and practically, etc. And both of those lead to the the bodily stress responses that you showed us and you talked about. So just to, I think there's always the risk or the importance of just reminding ourselves what is under my control and what is not under my control as a child or as a parent or as a professional as well. So let me open it up for some questions. If you just unmute yourselves and just wave your hand, or if anybody wants to make a comment or ask a question. You can also write them in the little question box if you like. I heard somebody unmuting themselves. Is that a question approaching?
Hello, it's me.
Hello, Wendy. Yes.
Thanks, Khalid. Thanks, Petrus. That was great, Khalid. I'm curious to know, we talk about all the negatives, but what about some of the positives of what's happened? I'm intrigued that not all the families I speak to, despite being living under kind of very, very challenging situations, are actually quite optimistic, and it's not all bad news. So was there anything in the literature about kind of positives for this in this period, or I don't know if there's anything from past stuff, but it's not all, doesn't have to be all negative, I suppose is what I'm asking.
Yeah, lovely question.
Yeah, okay. I honestly, when I search about this topic, maybe it was like a biased search in my preparing for this topic. But of course there are some positive issues I can say, especially at the social levels. You know, people, they discover each other, they start to communicate at one home, I mean, and yeah. So I'm just in my talk, I focus mainly on the negative consequences.
Sure. And maybe there's a lesson for us, Khalid, that all of us, as we work with families and talk with people, we might ask about all the challenges, but then also say, so what good things have come from it? What positive things have you learned or gained from it? And maybe we will learn, you know, and Wendy, we should, you know, proactively perhaps collect some of that sort of positive outcomes as well. John Joe.
It's a little related to Wendy's question, and this is certainly no research that I've done on this, but just qualitatively with the patients I've worked with. For a lot of them, they've really struggled with school in particular. So these are anxious kids or kids with social difficulties or learning difficulties. And a lot of them are loving lockdown. They don't have to go to school. This is a really positive thing. So one stress has been replaced by another. And I guess that's, yeah, for a lot of them, it's a very positive experience. They're not that concerned about global pandemics. They just don't have to go to school. So school avoidance is not an issue. Of course, it's difficult for parents. They become more stressed because they're worried about what happens when they have to go back. And it probably will be more challenging. But that's been, for me, an interesting kind of dynamic. Certainly not everyone is hating.
Yeah, no, that's a really interesting comment. Yeah, and I guess you're right. Then it's that transition back that might become the trigger, or when people need very particular routines during the day at home, and that can't always be achieved. So in kids with autism or intellectual disability, we might have some of those kind of stresses. Georgia.
Hi, thanks Khalid for that really interesting talk. It's also kind of related to that point. I just had a thought now. I mean, obviously I really don't know that much about it all, but just related to some of the reading I did, guided by John Joe actually, on telemedicine and telepsychology or psychiatry. It was quite interesting to look at the positives of that, and how, as a result of this, a lot more emphasis is being put on telemedicine. And there's actually quite a lot of advantages to that, even in a different situation to COVID-19, and how people who, it's a lot more equitable in some instances, where people who can't really make it to a department or to the doctor, issues with transport and financial issues and just accessibility, how it's actually making care more accessible to a lot of people. So maybe it's a positive that people are exploring telemedicine more, maybe.
Great comment, Georgia. Thank you. And in fact, just earlier this morning, I sent an email to Wendy to say it would be really nice to know if there's an official provincial position on rules in terms of us accessing families via, say, Zoom or other kind of technologies for clinical care. Because at the moment, most of you use the telephone to check in with people, but when and in what way can we start to reach out to families for clinical evaluation, for clinical support, for interventions through technology? I think that would be really, really helpful to know. Wendy, I don't know if you have a comment already, or if there isn't any news or official position yet.
The HPCSA sent out guidelines for psychology and psychiatry. I haven't seen any for government policy. The psychologists, I think, I vaguely recall about psychology somewhere. So I don't know if any of the psychologists want to comment on it, but I don't think, I mean, other than telemedicine, about which there's a lot written, and I shouldn't see that Zoom and Skype would be any different to telemedicine, really. I think the biggest issue is the confidentiality and safety and the medium with that you're using, which is an issue. But I haven't seen anything specific about this period. But I don't think it would be different to telemedicine.
Yeah, and so for instance, in the USA, Zoom Pro, which is what we're using for this call, is the only electronic medium that is what they call HIPAA compliant. In other words, is seen as of sufficient security and data protection for clinical transactions. So that's an interesting, but these are some details that I think would be really useful from a patient safety point of view. John Joe, you had your hand up.
Yeah, just on that, Georgia did some lovely investigations into telehealth and telemedicine, and on the ground, I mean, the actual sort of HPCA guidelines are very helpful, but the implementation of it is a bit less clear. So even over this period, it's changed. So initially it was thought that Zoom was fine, and then suddenly we were told MS Teams is the only one we should go with, and now it seems to have changed back that Zoom is possible. So it's made it quite difficult to know exactly who we should be going with. But I think it's worth saying that we actually had a bit of a discussion about it this morning, and Petrus, you and I have spoken how this is sort of magnified discrepancies. So in fact, many of the patients we see don't have access to internet or data, and it's not possible to do that. So for a lot of the families, the ones off at risk, it's usually telephones is the best we can manage.
And this may give us, these sorts of times you will have seen in the university. I think many South African universities have been very responsive to give students access to devices or data, or to have free internet sites or web pages, etc. If these kinds of principles can also be applied to families, for us to find ways of connecting with them with data, so that it's not their data that's used on their smartphones, that these things can be safe and secure, then we do have real potential to reach many more people in many different ways. Stella, you have your hand up. Very nicely put up.
Thank you, Prof. And thank you, Khalid, for this interesting presentation. I think I'll just talk on Wendy's point about the positives. Let me start personally. For me and my family, I think we started kind of feeling like we're loving this period, because it feels like there's some sense of calmness You know, like when you go out, there's some calmness. The world is not too busy. You know, it's not overwhelming. You know, places are not crowded. You know, the traffic is not congested. It's easy to get to work, and so that sense of calmness, which also comes with less crime, of course. So I felt it. My family felt it. Felt like, oh, lockdown. I wish, you know, we could have periods, intermittent periods of lockdown even after COVID-19, you know. But quite interestingly for my patient again, that I engaged with telephonically yesterday, I did get a feedback that as they are doing schoolwork and Zooming at home, the parents reported that the patient is more focused now, and she did not really need medication as much as she normally does when she is at school. And we kind of attributed that to perhaps one-on-one, because now she's like one-on-one with mom, less distractions, less challenges, interpersonal challenges at home, like it normally happens at school, and other things like less interpersonal problems, which would bring up some behavioral problems at school. So she was giving much less medication. So it was quite a positive thing, except that the parent can't stay at home for forever. So I do want to also confirm that there is some positives in this time. It's not all negative.
Great. Well, Stella, that's a very nice way for us to end on a positive note, to hang on to the good things that can come with challenges as well. And I guess for us to develop resilience, we need some adversity. Without adversity, there cannot be resilience. So Khalid, thank you for presenting today, and thank you everyone for joining and for your participation. And we'll see you all at the seminar next week. Thank you. Bye-bye.
Bye.
Bye-bye.
Thank you.
Thank you.